Welcome back, everybody, for another deep dive.
Always exciting.
And today, we're going to be diving into something kind of a fascinating story.
Yeah.
Where politics and education and mental health,
They all collide.
they all collide, exactly.
Yeah.
So you might have heard about this thing called the Mental Health Matters Act.
Right.
It seemed like a pretty straightforward bill,
Mm-hmm.
aimed at giving schools more resources to support students' mental well-being.
Right.
But here's the thing. Despite passing in the House back in September 2022,
Okay.
it only got a single vote from a Republican.
Wow.
All 205 no votes were Republican.
That's wild.
Yeah, and so we're going to kind of unpack
Yeah.
what happened here, why this matters, and what this might reveal about the bigger picture.
Yeah, and what's really fascinating about this particular act is that it's not just this kind of vague, we're going to improve mental health.
Right.
It had specific goals.
Okay.
Like, giving schools grants to hire more mental health professionals, expanding services in areas that really need them, offering mental health protections for adults with private insurance, and children and staff in Head Start programs.
So on the surface, it sounds like something most people would get behind.
Right.
Helping kids get the support they need.
Yeah, you would think so.
Yeah.
And that's kind of what makes this vote so fascinating.
All right.
So let's dive into the details, starting with why this bill was even introduced in the first place.
Okay.
So Representative DeSaulnier, a Democrat from California, was the sponsor.
Okay.
And his main argument was that educators are increasingly overwhelmed by the mental health needs of their students.
Right.
They just don't have the training or resources to handle it all.
Right.
And he's got backup. The White House was fully on board.
Okay. So we have a clear need, proposed solution.
Yep.
Backing from the, highest office in the land.
Mm-hmm.
Where did things go sideways?
Well, not everyone was convinced.
Okay.
Representative Fox, a Republican from North Carolina, voiced a major concern.
Okay.
And it really came down to this. He was not a fan of the penalties that this bill would impose on employers who denied mental health benefits.
So like businesses.
The businesses.
Yeah.
His argument essentially boils down to this: it's too much of a burden.
On businesses.
On businesses, exactly.
Right.
Now, this raises a really important question, though.
Okay.
How do we balance the need for mental health coverage with concerns about employer costs?
Right. Because you can't just say, mental health is good. Everyone should pay for it. No questions asked.
Exactly.
There are economic implications to consider.
Yeah, absolutely. There are real-world implications there. And it's worth noting that, Rep. Fox's objection wasn't shared by all Republicans.
Right.
We did have that single Republican yes vote from Rep. Fitzpatrick of Pennsylvania.
Right.
So at least there's some variation within the party on this issue.
Well, that one vote really sticks out, right? So
Yeah.
it makes you wonder what influenced his decision.
Right.
Especially considering the reaction we saw from some Democrats.
Oh, absolutely. And speaking of reactions, Representative Pascrell Jr., a Democrat from New Jersey, had some pretty strong words
Okay.
for those who voted against the bill,
Uh-huh.
essentially accused Republicans of turning their backs on kids in need.
Wow.
And even went so far as to say that their no votes were like telling those kids to go to hell.
Wow. That's strong.
Yeah, that's not really, your typical political rhetoric.
No.
But it shows you how intense this debate really is.
It really reveals the emotion, right?
Exactly.
Yeah, and it makes you think if this seemingly, common sense bill is causing this much tension.
Right.
Like, what does this tell us about where we are politically when it comes to mental health?
Yeah.
Like, are we making progress or is it just all talk?
Well, that's the million-dollar question, isn't it?
Yeah.
We hear a lot of talk about mental health, especially from Republicans after tragedies like mass shootings.
Right.
Often they point to mental illness as the root cause.
Mm-hmm.
And, sometimes it seems like they're trying to shift the focus away from gun control.
Right. But when it comes to putting money where their mouth is,
Yeah.
the support seems less consistent.
So it's kind of like mental health is a big problem, but don't ask us to actually fund solutions.
Yeah, it's a pattern we've seen before.
Yeah.
And it's particularly striking when you look at specific examples, like what happened after the Uvalde shooting.
Oh, right.
Remember Representative McCarthy?
Yeah.
The Republican who voted against the Mental Health Matters Act?
Mm-hmm.
He was on Fox News calling for more mental health funding immediately after the tragedy.
Right.
But then he turns around and votes against the very bill that would have done exactly that.
So we have this disconnect between rhetoric and action.
Yeah.
Which is obviously frustrating for a lot of people who see this as a real crisis.
Right.
It seems like there's this underlying tension, this question of, should mental health even be a political issue at all?
You've hit the nail on the head.
Yeah.
And this tension was further fueled by the pandemic.
Oh, how? Well, Republicans have been very vocal about the negative impact of school shutdowns and remote learning on kids' mental health.
Right, but there's also the argument that prioritizing safety,
Yeah.
over maybe immediate mental health concerns was the responsible choice.
Exactly.
Yeah.
It's not a simple issue.
Right.
Imagine the potential impact on kids' mental health if schools had reopened hastily
Right.
and teachers or caregivers had gotten sick or died.
Right. It's about competing priorities.
Exactly.
And it's not black and white.
No, and the pandemic really brought that complexity to the forefront.
So we've got a lot to unpack here.
Yeah.
A seemingly straightforward bill has exposed these deep divisions, sparked some, heated debate.
Yeah.
It seems like everyone agrees that mental health is important, but the question of who's responsible for doing what
Right.
and how we actually improve things, well, that's where things get messy.
That's where it gets really messy.
Yeah.
And I think what's important for you, the listener, to consider is this.
Okay.
How do we move beyond this gridlock? How do we find common ground
Right.
on an issue that clearly impacts everyone?
That's a great question, and I'm curious to hear your thoughts on how we might start bridging that gap. But first, let's take a closer look at some of the arguments being made on both sides.
I think one way to bridge that gap is to kind of shift the focus away from those political ideologies that divide us
Okay.
and instead focus on those shared experiences and challenges that unite us.
Mm-hmm.
For example, both Republicans and Democrats can probably agree that, students are facing just unprecedented levels of stress and anxiety these days.
Right.
We can also probably agree that educators need more support
Yeah.
to effectively address those issues.
So it seems like maybe finding common ground on the problems might be easier than agreeing on the solutions.
It might be.
Yeah. But how do we move beyond just acknowledging the problems and into actually, taking action?
Well, one thing we could do is kind of shift the focus away from these federal mandates
Okay.
and these penalties, which tend to be very polarizing, and instead look at maybe some more localized solutions,
Okay.
like empowering, individual school districts to allocate resources based on their specific needs and their community values.
Okay, so kind of like a more bottom-up approach
Exactly.
where communities have more control
Yeah.
over how they address these mental health challenges in their schools.
Mm-hmm.
But wouldn't that lead to like inequality in terms of resources?
It could.
Like wealthier districts would have a significant advantage.
That's a valid concern.
Yeah.
And it's something we would need to address carefully.
Right.
Maybe a hybrid approach could work,
Okay.
where federal funding is still provided, but with more flexibility in how it's used.
Okay.
We could also look at, incentive programs
Yeah.
that encourage districts to prioritize these mental health initiatives.
Yeah, it sounds like there's no like one-size-fits-all solution.
There isn't.
But there is a need for creative problem solving that takes into account, these diverse perspectives and local contexts. Speaking of diverse perspectives,
Yes.
I keep thinking about that one Republican vote in favor of the Mental Health Matters Act.
Yeah.
And it makes me wonder if that represents kind of a potential crack in the party's, seemingly unified front on this issue.
It's possible.
Yeah.
It's worth noting that Rep. Fitzpatrick, the Republican who voted yes,
Mm-hmm.
represents a district that leans slightly Democratic.
Okay.
So his vote might just reflect, the views of his constituents more than any kind of significant shift within the Republican Party as a whole.
That's a good point. It's a reminder that representatives are supposed to be representing the people who elected them.
They are?
Yeah. And those views can vary so widely,
Yeah.
even within the same party.
Oh, absolutely.
Yeah.
And it highlights the importance of civic engagement
Right.
and making sure that, your elected officials really understand your priorities.
So if you're passionate about mental health, reach out to your representatives.
Do it.
Let them know where you stand on these issues.
Your voice matters.
Yeah, I completely agree. It's easy to feel powerless when you see these, deep divisions in Congress.
Right.
But remember, we do have the power to
Correct.
influence our elected officials.
We absolutely do. And it's not just about contacting your representatives.
What else can people do?
Well, you can support organizations that are working to improve mental health services,
Okay.
advocate for policies that prioritize mental well-being,
Mm,
even just talk openly about mental health with your friends and family.
yeah.
These conversations can really help reduce stigma and encourage people to seek help when they need it.
I think that's so true. Sometimes the most powerful thing we can do is share our own experiences
Yeah,
and listen to the experiences of others.
absolutely.
It creates that sense of connection and helps us realize we're not alone in our struggles.
Exactly. And it really challenges this narrative that mental health is something to be ashamed of
Right.
or hidden. We need to normalize seeking help
Yes.
and create a culture where it's seen as a sign of strength, not weakness.
You're right. We've made some progress there, but there's still a long way to go.
Oh, yeah.
It's like we're in this weird in-between space where we recognize mental health is important, but we haven't figured out how to translate that recognition into meaningful action.
It's a bit like we're all standing around a giant puzzle,
Okay.
staring at the pieces, but not quite sure how to put them together. We
Right.
have the pieces,
Yeah.
the research, the personal stories, the dedicated professionals.
Yeah, we have all the pieces.
But we need that shared vision,
Okay.
that framework that helps us kind of make sense of it all and guides our efforts.
That's a great analogy. It feels like we're missing that overarching narrative, that compelling story that connects all the dots and inspires us to act collectively.
Right.
Yeah.
Perhaps one way to find that narrative is to focus on the human impact of
Right.
these mental health challenges
Mm-hmm.
instead of getting bogged down in these abstract political debates.
Right.
Let's bring it back to the personal level. Let's talk about the students who are struggling to focus in class because of anxiety,
Right.
the teachers who are burning out trying to meet their students' needs,
Yeah.
the families who are just desperately seeking support for their loved ones.
These are the stories that I think can transcend the political divide
They can.
and remind us why this issue matters so much.
Absolutely. It's easy to get lost in that political back and forth.
Yeah, it is.
But we can't forget that there are real people at the heart of this issue,
Right.
real people whose lives are being impacted every single day.
Absolutely. And their stories deserve to be heard.
They do.
They should be the driving force behind our policy decisions
Yes.
and our, collective efforts to create a more supportive and compassionate society.
Remember the example of Uvalde.
Right.
It's a stark reminder of what can happen when mental health is neglected and marginalized.
Right. We can't let these tragedies be what defines our approach to this issue.
We can't.
It feels like we're at a crossroads. We can continue down this path of division and inaction.
Yeah.
Or we can choose a different path.
A different path.
A path that prioritizes empathy, collaboration, and a deep commitment to the well-being of all people.
That's the path we need.
So it's a choice we all have to make individually and collectively.
We do.
And it starts with recognizing that mental health is not a partisan issue.
It's not.
It's a human issue.
It's a human issue that deserves our attention, our compassion, and our unwavering commitment to finding solutions.
And while the Mental Health Matters Act may not have achieved, its intended outcome,
Right.
it did something incredibly important.
What's that?
It started a conversation.
It did.
And it's a conversation that needs to continue.
Absolutely. But how do we move that conversation forward
Right.
in a way that actually leads to meaningful change?
What are those tangible steps we can take to bridge this gap between, the rhetoric and action?
That's the question we're going to explore in our final segment.
Okay.
We're going to delve into some potential paths forward. Okay.
And some strategies that can really help us turn those good intentions into real-world progress.
Stay tuned. We'll be right back. All right, so we're back.
Back again.
And we've been talking about this, this whole situation with the Mental Health Matters Act. And it seems like, we all agree that mental health is super important, especially for young people.
Absolutely.
But it feels like the path to getting them help is so tangled up in politics.
It is.
So what are some ways we can actually move forward
Yeah.
and turn all this talk into real change?
That's the key question, and I think it has multiple layers.
Okay.
First, we have to acknowledge that this isn't just about passing one bill.
Right.
It's about fundamentally shifting how we as a society
Correct.
value and prioritize mental health.
So how do we do that?
Right.
That sounds really big picture.
It is, but it's not impossible.
Okay.
Think about it this way.
Okay.
Not too long ago, talking about mental health was taboo.
Yeah.
Now it's becoming more common.
Right.
That's progress.
Yeah. But we need to keep pushing.
Okay, so what does pushing look like?
We need to make mental health checkups as routine as physicals,
Okay,
especially in schools.
that makes sense. Start early.
Exactly.
Catch those issues before they become big problems.
Right.
But that takes resources, right?
It does.
And that brings us back to that funding debate.
It always comes back to funding, and this is where you, the listener, can really make a difference.
Oh, so.
Contact your representatives,
Yeah.
local and national level, and tell them that mental health needs to be prioritized in budgets,
Oh.
support organizations that are doing good work on the ground, And vote for candidates who have concrete plans,
Right. Not just vague promises.
not just lip service.
Right.
We need to see action.
So it's about, being informed and engaged citizens.
Absolutely.
Yeah. But beyond that, it feels like we need to change the whole narrative around mental health.
I agree.
Like it shouldn't be this thing we whisper about
Yeah.
or only talk about when there's a tragedy.
Exactly. We need to destigmatize it completely.
Okay.
And, think back to that one Republican vote on the act. It reminds us that even within these political parties,
Right.
there are individuals with different viewpoints.
Yeah.
We need more of those voices to speak up,
Okay.
share their stories, and advocate for change.
Yeah, that one vote really did stick with me.
Yeah.
It's easy to get discouraged when you see, how divided things are.
It is.
But that one, yes, shows that there's potential for common ground,
There is.
even on something as, emotional as this.
Absolutely. And it goes beyond politics, too.
Where else?
Your family, your friends, your workplace.
Okay.
By talking openly about mental health,
Mm.
sharing resources, supporting each other,
Yeah.
you can create this ripple effect
Yeah.
that challenges that stigma.
It's almost like we need to create this culture where it's okay to not be okay.
Exactly.
And where seeking help is a sign of strength, not weakness.
100%. We need to shift that narrative from blame and shame to support and understanding.
And I think that's a really good point to end on.
Yeah.
Because it sounds like we've got work to do,
We do.
but it's not impossible.
Not at all.
And it starts with these conversations.
It does.
It starts with, being informed and engaged and supporting each other.
Absolutely.
So thanks for joining us on this deep dive.
My pleasure.
Until next time,
Yeah.
stay curious, stay engaged,
And take care.
and take care of yourselves and each other.